Hello and welcome to the short training course on the use of the DHS2 system to report outputs of activities supported by Ascent into a centrally hosted database. In this short presentation, I will quickly go over the objectives of the Ascent project and explain how we plan to monitor our progress towards targets. So first of all, what are the objectives of the Ascent program? Well, in the original business case presented by DFID in 2019, there were 5 different objectives specified, which are shown on this slide. Firstly, the first objective was that the relevant aspect of the health system should be strengthened to ensure sustainable delivery of NTD control and elimination activities. So these are all our efforts we undertake to support countries to improve the systems in country to deliver NTD control in a sustainable manner. Secondly, there's an increased coverage of preventive treatment for NTDs within the program countries. These are basically all our MDA activities, so the provision of preventive treatments. Thirdly, there's the increased coverage of curative treatment and morbidity management and disability prevention services for NTD within program countries. These are all the clinical support we provide to country for hydrocelectomies, lymphedema, wound care, or TT surgeries. Fourthly, there's an increased coverage of appropriate preventive measures, including hygiene promotion and behavioral change communications. So these are all our sensitization and awareness raising activities, behavioral change communications, etc. And finally, there's an increased knowledge and evidence for the effective response to NTDs. So this is our learning agenda. What do we learn within the DSM program on the delivery of NTD control, which can be taken forward and optimize the planning and delivery of NTD interventions in the future. So where do we work? As you might know, the Ascent program is split over 2 lots, Lot 1 and Lot 2, and we work in Lot 1, which focuses on 12 countries. There are 9 different countries in Eastern Africa, and there are 3 countries in Asia. So in Eastern Africa, we work in Sudan, South Sudan, Ethiopia, Uganda, Kenya, Tanzania, Malawi, Zambia, and Mozambique. And in Asia, we work in India, Nepal, and Bangladesh. So clearly, each of these countries have a different NTD profile and hence require different types of interventions. So what are our exact targets for the Ascent program? So as you might recall, at this moment we have a target of 118,991,254 preventive chemotherapy treatments, which we're supposed to deliver across the following diseases: lymphatic filariasis, schistosomiasis, onchocerciasis, and trachoma. So this is an enormous number, but this is split out over different countries, as shown on this slide. So here you see on the left-hand side column the different countries, and then on the column headings the different diseases. And for each of the diseases, it shows the original target we had at inception back in September 2019, and now the updated targets as presented in our annual report of July 2020. So here you can see that for the different countries, there's quite some variation in the diseases which we support and the numbers of treatments for each of the countries. So clearly this shows that the majority of PC treatments are expected to be delivered in Ethiopia, Tanzania, and Mozambique. So at the current moment, we have 143,312 treatments for mobility management and disability prevention scheduled in our target. So these are hydrocelectomies, TT surgeries, and lymphedema care, wound care management. In addition to this, we have a target for visceral leishmaniasis, which applies both in Asia as well as Africa, where we expect 25,000 additional cases of VL to be found, diagnosed, and initiating treatment across these countries. So to monitor these targets, of course, that you can imagine it's a quite extensive system which we require. So in the next slide, I just quickly want to touch upon the different elements we're trying to support and put in place, which would allow us to monitor these targets. So you see here is the schematic framework of the components of a functional MEL system, which is taken from the UN. Then the outer shell here in gray, you see what we call the enabling environment. So in order to have a good functioning MEL, we need organizational structures, we need the human capacity, we need partnerships, we need a solid plan, but also the funding to implement that plan, as well as advocacy communications and a culture which fosters the use, the collection and use of monitoring and evaluation data. In the middle circle on blue, you see the different tools and utilities which we require for a functional MEL. These are surveys and surveillance to monitor, to collect data. We need databases in which we can store that data with collection. We need supervision and data auditing to ensure that the data is of sufficient quality, and we need evaluation and research to actually make good use of that data. And in the end, this would all be done in a routine manner. So all of these together culminate to what's shown in the center, which is the dissemination and use of data, which is the purpose of what we're going to present during this training course. How are we going to collect and disseminate and use our data to improve our monitoring and evaluation within the DSM program?